Oh, sorry. Do you want to put it in my pocket?
Yeah, that'd be great.
And now it's like, oh, I have to go. I've got back pain. Do I get the 2 weeks COVID leave? It's probably supposed to be good.
Yeah. Well, it's very good out there. Do you have to second guess yourself now and go, oh no, I can smile, or you?
No, it's just natural now.
Yeah.
Yeah, makes a big difference.
It really does. It really does. And you've got a great smile. It would have been a shame to hide it away.
Hi, I'm Wayne and I'm from Canning Vale. I'm a nurse manager at the Perth Children's Hospital and I've got 4 kids. The youngest is 19, so at the moment we're sort of getting to the end of our torment. We've got a 28-year-old that's a high school teacher. She's in Geraldton. We've got a 23-year-old. He's doing his PhD in Russian literature and he's learning Russian, which is driving his mother and I crazy. We've got a 23-year-old that's doing medicine and she's on placement in Albany at the moment, and a 19-year-old that's in his first year of nursing at Notre Dame. Well, I had a history when I was younger. I had a dentist that I went to and they used to fill every tooth in my mouth, and I didn't have any toothache, or I didn't think I had dental caries, but I ended up with like silver fillings on every molar, and I was wondering if they were just using me as practice. I don't know, but I had these.
I hope not.
I had so many, and that sort of concerned me a bit, because one of the things my mum and dad were always very strict was brushing your teeth. Was diagnosed mid-50s with type 2 diabetes mellitus, and I think that affected my teeth in that they went brittle. And I was on my way into work one day and one of my teeth snapped off, and it was right at the front. And I thought, oh my God, you're heading into a children's hospital looking like a total bogan. So I had my broken tooth in my hand and I covered my mouth and walked through to my office. And I found my boss and I said, look, I'm going to have to go home. And she said, why? And I said, because my tooth just snapped off. And she said, show me. And I went and showed her, and she's like, oh my God, yes, go home, that's good. So off I went, and on the way, before I left, I rang the dentist and said, look, I really need my tooth broken off. So I went to the dentist and they basically glued it back in, and they said, this is a temporary fix, we'll have to work out a plan of care, but it's an aesthetic thing. So I did that, went to work the next day. On my way in, the tooth snapped off again. I was like, I can't believe this. So I thought, I'm not even going to ask. I just turned around and I rang her from the car park and said, look, my tooth snapped off, I'm so sorry. So I went home, went back to the dentist, and I said, look, this is really not good. And they did a different kind of fix on it where they put a rod down the middle of it, and basically it was almost a permanent fixture. Then she said to me, I really do think you need to look at prosthodontics, because your teeth are very brittle and the likelihood over the next few years of more teeth snapping is very high. And I had, prior to that, had a bridge removed from the side at the top of my mouth, and that was, or she said it was placing pressure on the remaining teeth, and that was why they were probably snapping, because when I was eating it was like all on one side. So I did that, and then she said, you know, look around for different prosthodontists, and of course I saw Michael Zaninovich. Well, I basically was looking online and I listened to Curtin Radio, and there was lots of ads on there, and I thought, I've got to try that, so that's really good. I tried another couple. One practice never got back to me. And I just thought, no. And with Michael, the response was really good, and I got an appointment, and it was good, yeah. So I was very fortunate to
find him.
Yeah. One of the things that concerned me was the cost, simply because we're sort of at I'm 58 and we're working our way to retirement, and we sort of thought, anyway, so we went in and I took the War Office with me, and she's very good at bargaining. We basically, Michael was very receptive. He met with us, he spoke, he opened up, any questions you've got, feel free to, tell me what you think. And he was great, he was really good. We went through all sorts of options, and then he said, okay, we'll meet again. I'll give you plan A, plan B, plan C, and you can make a choice.
So it was in your hands, really.
Yeah, and he was very good, and it was really nice to have someone that was so responsive to my needs. Yeah, and it's sort of funny to say that, but as a nurse, you're so used to giving all the time, and to be getting was a completely different kettle of fish for me. And it was like, having someone that's sort of interested in your well-being and made a big difference.
It's like the switch is flipped.
Yeah. So it was really good, and it was very nice to know that I had a journey ahead of me to get things better again. Yeah. Well, going in was not a problem. Free parking makes a big difference, because by the time, if you're running late or anything like that, it just made such a difference. Going in to the meetings, the staff were great, very receptive. The reception staff were lovely. The nursing staff, the technicians, everybody was really friendly, and always open to asking, do you need anything, or do you have any concerns, and that was all the way through. On every appointment I was asked if you have any concerns or any updates for us, and everything was listened to, and that made a big difference. Along the way there were things like, I think this might be a little narrow because I'm lisping, and they would say, okay, and then the next time you come they'd have redone it and it was wider so that you didn't have the problem that you had. So it was good, and people would come down from the laboratory, talk to you, make sure they got everything right. Honestly, I can't fault it. It was very good. I was really, really impressed with the service that I got from everyone. Yeah, I can't think of any negative instances I've had with anyone in that practice.
So it's all positive.
From the front door in to the front door out. Doesn't matter what the situation has been. There's so many things. When I first had my teeth removed, pain relief, antibiotic medication, anything was all taken care of. And ringing up once at home to check on things, to get clarification, there was always someone available. And if they weren't, they'd ring back pretty much straight on. Yeah, it was unfaultable, really, really good. My area of work was adolescents, so they're all older and much more honest, and they'd swear and be like, "What the?" and if you went in there with a tooth missing in the front, they'd be very honest and tell you what they thought. And I had my kids are very honest as well, and they'd be like, "God's sake, Dad, you need to get that fixed." So if the age hasn't changed for my retirement age, I'm 58. I think it might be 67 now.
Wow.
So if that's the case, I've got 9 more years. But
unless you win lotto.
exactly, one Powerball. It's probably more of a aesthetic thing, in that when I had problematic teeth, I wasn't smiling. So you sort of keep your mouth closed and don't say much. Whereas as soon as this was done, it's good because you can open up, you know, smile, laugh. Yeah, and it makes a big difference. Especially in a job like mine where you're dealing with people every day, all day. It makes a big difference. Yeah, but yeah, it's all good now and I've got it all under control and makes a big difference.